Hi, my name is Jennifer Hobbs. I'm a student at Auburn University in the Primary Care Nurse Practitioner program. Today I'm going to be doing a brief overview of precocious puberty. Precocious puberty is considered early onset of puberty in boys before the age of 9 and in girls before the age of 8. Boys normally have puberty between the ages of 9 and 14 and girls between the ages of 8 and 11. There are several causes and risk factors for precocious puberty. These include congenital anomalies, head trauma, strong family history, adrenal tumors, testicular tumors, oral contraceptive use, hypothyroidism, and estrogen and testosterone abnormalities. So, in these children, you want to do a thorough family history and a thorough physical exam. In the family history, you would want to ask if there have been any previous people that have had precocious puberty. If so, were there any identifiable causes? Has there been anyone in the family that has had just an accelerated rate of growth during this time that was not considered precocious puberty? You also want to ask, in females, have they started their period? In males, have the parents seen any maturity signs such as voice changes or any other abnormal things that would happen at an early age, such as hair growth or interest in sexual behaviors or anything such as that. So, in a physical exam with girls, you would want to look at hair distribution, breast development. You've already asked about the period, so you also want to check a thyroid to see if it's abnormal in boys and girls. In boys, you would want to look at hair growth, you would want to look at penis, scrotum, testes size, and you would want to assess for body odor. And in both of these children, you would also want to look at a growth chart. A growth chart is going to help you out tremendously, especially if you have prior charts to go by. So on these children, whether they're in early or normal puberty, a growth chart is going to show a rapid or accelerated rate of growth. So in children with precocious puberty, you're going to see this rapid acceleration of growth at an earlier age. So there's going to be your height, your weight, and your percentages that you can go by. And like I said, whether you have prior or only your current information, you can look at that and you can tell, are they at a normal growth rate for their age. So now that you went through the physical exam and the family history, you would want to do some diagnostics to see if you can identify a cause. 90% of female cases and 50% of male cases are idiopathic or considered no known cause. A lot of these are contributed to people with a family history of precocious puberty. So some tests that you can do are a FSH level, an LH level, a GnRH level, TSH, free T4, testosterone, estrogen, and in females you can do a swab in the office that detects estrogen. So if they are currently in puberty, you can actually tell that with a swab. So another exam that you might want to do on the female is a pelvic exam. You can actually assess their ovary size to make sure that they're not abnormal. You could do an ultrasound. You can also identify if they're tender, if their ovaries are overproducing estrogen, they may be tender to touch. There's also some bone studies that you can do to see if their these both male and female are growing at the rate that they are supposed to. So with the test, if there's nothing that comes back, then you would probably contribute this to a idiopathic or non-organic cause. If there is a cause, then you would obviously want to treat that cause with estrogen or testosterone treatment or with GnRH suppressant therapy. So if you identify a cause, treat it. If you don't identify a cause, you obviously don't do anything. With both of these cases, you'll monitor for 3 to 12 months. With either case, you definitely want to provide support, education, and counseling. These children need to know what to expect. The parents need to know what to expect. And you definitely want to monitor for self-esteem issues, early sexual interest, and drug and alcohol behaviors, because these children are at higher risk for all of those things. I hope I've covered everything. Thank you.